Why do kidney hurt? All causes, symptoms and various treatment for kidney disease. Interesting about science and medicine prepared by editors of a page all scientific. Where are the kidney located? The kidney are first sized organs located on each side of the spine, just above the waistline, and play a vital role. What do the kidney do? They purify the blood by eliminating waste and excess fluid from the body. What else do the kidney do? They maintain a healthy balance between various chemicals in the body, such as calcium, sodium, potassium, and chloride. A special function of the kidneys is that they help lower blood pressure. What happens if the kidneys get injured or sick? When the kidneys become sick or injured, they may lose the ability to perform their vital function all at once or gradually. What happens to the body if the kidneys get sick? As a result, various waste products and excess fluid accumulate in the body, causing various symptoms, especially swelling of the hands and feet, shortness of breath on exertion, and an unbearable need to urinate frequently. If left untreated, affected kidneys can stop function. Loss of a kidney function is a dangerous condition, potentially fatal. What parts of the kidneys can be affected by disease? The kidneys can be prone to various diseases. They can affect the particles that filter the kidneys, nephrons, the tissue that support them, or the blood vessels that are responsible for blood circulation to the kidneys. How do kidney infections occur? Kidney infection occur when infectious organisms, usually bacteria, enter the body and travel to the kidneys, where they cause swelling and inflammation. A kidney inflammation can be acute, appears suddenly, or chronic, recurs intermittently over many years. Are kidney infections dangerous? Kidney infections are very serious. If left untreated, they can cause irreversible damage to the kidneys and lead to chronic kidney disorders. The infection can also spread into the blood, causing their poisoning. Anyone can get a kidney infection, but in pregnant women, the risk is higher, in part because the pressure of a fetus on the bladder makes emptying the bladder difficult. The urine left in the bladder is a good environment for the development of bacteria. Classification of kidney disease, nephropathy. Kidney disease or nephropathies are classified into 4 large groups depending on the affected part of a kidney. Glomerular damage, damage of urinary tubes, renal glomerulus, and urinary tubes form the nephron, the filtering part of a kidney, damage to the supporting tissue of a kidney's interstitial tissue, damage to the blood vessels that provide blood to the kidneys. What is glomerulonephritis? The signal of such problem is nephrotic syndromes, which is characterized by significant fluid retention, edema. What types of glomerulonephritis are there? Glomerulonephritis can be acute or chronic. Chronic glomerulonephritis can cause irreversible change in the kidneys that can no longer provide a filtering function, renal failure. Why does acute glomerulonephritis occur? May occur as a result of untreated angina pectoris. Treatment of acute glomerulonephritis. Treatment of disease consists in eliminating the symptoms, restriction of fluid and salt intake, taking diuretics to reduce swelling. As a rule, the disorder is treated in 2 weeks, most often without any special consequence. Can acute glomerulonephritis occur due to medication? Sometimes acute glomerulonephritis is associated with medication used to lower blood pressure. Why does chronic glomerulonephritis occur? This disease can occur without no causes, meaning nephrosis. Chronic glomerulonephritis can also occur as a consequence of certain diseases, diabetes mellitus, malaria, autoimmune disease, when the body is attacked by its own immune system, disseminated lupus erythematosus, rheumatoid purpura. Also, the occurrence of this disorder may be affected by the intake of certain medication, gold salts and deep penicillin. What type of urinary tube disease tubulopathy exists? This category of kidney disease is characterized by tubulopathies. In turn, tubulopathy can be acute or chronic, less often. Causes of acute tubulopathy. Acute forms of tubulopathy are characterized by the destruction of a urinary tubulus for the following reasons: excessive intake of certain medication, for example antibiotics, absorption of toxins, heavy metal, lead, cadmium and others, anaphylactic shock. Symptoms of acute tubulopathies. Acute tubulopathy is accompanied by acute renal failure. Urination stops. Treatment of acute tubulopathy. Treatment require, first all, stopping the reception of medical preparation responsible for the situation. In the most severe cases, temporary blood filtration dialysis may be needed. Signs of chronic tubulopathies. Chronic tubulopathy can be characterized by various signs. The presence of glucose in the urine may be observed when the patient does not have diabetes mellitus. With these problems, the urinary tubules are unable to absorb certain substances, such as amino acids. This can lead to kidney stones and antidiuretic hormone insensitivity, promoting water absorption. This phenomenon leads to secretion of a very large amount of urine. Disease of a supporting tissue of the kidneys, interstitial tissue. Such problems arise as a result of a drug intoxication or a bacterial infection. Pyelonephritis. The most common disease of a supporting tissue of a kidney is acute pyelonephritis, which often affects only one kidney. Symptoms of acute pyelonephritis. This disease is characterized by urinary disorders, frequent urination with a burning sensation, cloudy urine, back pain in the area of diseased kidneys, elevated temperature. What disorders of the blood vessel of a kidney are? Nephroangiosclerosis and Goodpasture syndrome are most common diseases that affect the blood vessel of the kidneys. What is nephroangiosclerosis? Nephrangioleosclerosis is characterized by thickening sclerosis of the arteries and arterioles that provide blood to the kidneys. The disease results from a poorly treated or untreated hypertension over many years. Complication of nephrangioleosclerosis. With nephrangioleosclerosis, protein is observed in the urine. It leads in the long term to the inability of the kidneys to function normally, renal failure. Treatment and prevention of nephrangioleosclerosis. Treatment, often as a preventive measure, consists of monitoring and treating any hypertension. What is Good's-Pasture syndrome? Good's-Pasture syndrome is characterized by the production of antibodies by the body to fight its own component, which harm the walls of the vessel that provide blood circulation to the renal glomeruli and pulmonary alveoli. Complication can be observed in the kidney disease. Yes, kidney disease can quickly worsen with kidney failure, often even with the observance of a medical course based on corticosteroids and immunosuppressants. The disease progress requiring dialysis treatment. How is kidney disease diagnosed? For diagnosis, the doctor may order some blood and urine test, and if the kidneys are holding up, an X-ray examination of the kidneys, intravenous urography. If a diagnosis remains unclear, the doctor may prescribe a biopsy using a special needle. Kidney biopsy is a mandatory examination in order to diagnose some disease of the kidney, especially with glomerulonephritis. This procedure is done with a special needle and consists in taking the tissue sample for laboratory analysis. Puncture biopsy of a kidney required hospitalization 3 days, after which rest is necessary 7 days. It is done under the influence of local anesthesia and for this reason is not painful. Diagnosis of kidney infection. Blood and urine test. A thorough medical examination may be needed to diagnose a kidney infection and to identify the causative agent. This may require a urinary test and blood test. What other tests are done for a kidney infection? If you have frequent infection or if your doctor suspects a structural abnormality, other tests may be needed. The doctor may prescribe a following diagnosis method: intravenous urography, a method that uses X-ray to visualize the kidneys; cystoscopy, a technique that uses a lighted tube that is inserted into a urethra, is used to examine the bladder; and ultrasound examination, which gives a detailed picture of the kidneys. Symptoms of a kidney disease. The main signs of a kidney disease are: first, an urgent need to urinate, excretion of very small amounts of urine, swelling of the hands and feet and swelling around the eyes, bad taste in the mouth and smell like urine, constant fatigue or shortness of breath during physical exertion, decrease in appetite, increased blood pressure, pale skin, very dry skin with severe itching. What are the symptoms of a kidney disease in children? Increased fatigue, severe drowsiness, decrease in appetite, growth retardation. Symptoms of kidney infections. The main signs of a kidney infection are continuous pain that usually starts in the back, above the waist and spreads down to the pubic region, severe vomiting or nausea, cloudy or bloody urine, unbearable and frequent need to urinate even when the bladder is empty, a rapid rise in temperature, sometimes even up to 40 degrees. When to see a doctor for kidney disease? In the presence of various characteristic symptoms. Even though each of the symptoms may indicate other disease, each of them is a warning sign of kidney disease. that can be life-threatening. Consult your doctor. When to see a doctor for kidney infection? For symptoms that resemble a kidney infection that is very serious and requires immediate medical attention. When observing blood in the urine, it may also be a sign of other kidney disorders, kidney stones, bladder or kidney tumors, bladder or prostate infection. Consult your doctor immediately. Risk of a chronic kidney disease. Kidney disease is classified as acute when the loss of a kidney function is felt suddenly. They can be very insidious. Sometimes they are not accompanied by any symptoms until significant damage is noticed, and sometimes irreparable. What causes chronic kidney disease? The cause of chronic kidney disorders are sometimes difficult to identify. Most are the result of other diseases and conditions, such as diabetes, hypertension, or atherosclerosis. All such problems prevent blood flow to the kidneys. Lupus and other immune system diseases that damage blood vessels can also cause kidney problems, causing inflammation. Some chronic kidney disease, notable polycystic kidney disease, in which cysts form in the kidneys, are hereditary. Other diseases that affect kidneys are congenital and result from an obstruction or malformation of genitourinary system with which the patient was born. For this reason, the patient is prone to the infection and kidney disease. Chronic kidney disease can also be caused by prolonged exposure to certain drugs or toxic chemical or toxin on the kidneys. Research suggests that excess vitamin D and protein, especially in the diet or of elderly or very sick people, may harm the kidneys. But in many chronic causes, the cause of the disease remains unknown. How do acute kidney disease occur? Acute kidney disorder can occur suddenly within days of the onset of any condition that suddenly reduces blood flow to the kidneys. What causes acute kidney disease? Acute kidney disease can occur for the following reasons: heart attack, injury in a car accident, severe infection, a toxic reaction to certain drug. What toxin can harm the kidneys? Inhaling or swallowing some toxin can also harm the kidneys. Examples of the kidney toxin are methyl alcohol, carbon tetrachloride, antigel, poisonous mushrooms. They can cause sudden kidney dysfunction. Sports can harm the kidneys. Marathon runners and other endurance athletes who do not drink enough water during long-distance competition can suffer from acute kidney failure due to the sudden breakdown of a muscle tissue that releases a chemical called myoglobin that damages the kidneys. Causes of a kidney infection. Causative agents of a kidney infection. As with bladder infection, the most common causes of a kidney infection are Escherichia coli and other bacteria that normally live in the intestines. How does a kidney infection start? Indeed, as a rule, the infection begins in the bladder and then expands to the kidneys. Causes of a kidney infection. Use of catheters. Also, the use of catheters tube that are inserted into the bladder to empty it can cause a kidney infection. Catheters may be inserted during the recovery period after surgery and are also used to some people with certain neurological conditions that affect bladder control. Can traditional medicine be used for kidney disease? Kidney disorders are life-threatening conditions and require medical attention. Alternative therapy can be used as an adjunct to the main medical treatment, but it is recommended to consult a doctor in detail before using. Medication, especially those that control diabetes and hypertension, can sometimes help reduce the evolution of chronic kidney disorders. Can kidney be cured by nutrition? Some experts have noticed that some restrictive diets can be helpful, especially if the disease is detected early. But if the disease method do not help, But if these measures do not help, and the kidneys are destroyed to the point where they are completely unable to work, there are two types of treatment. Dialysis, during which special device cleans the blood of waste, and kidney transplant. Treatment of kidney disease. Angiotensin-converting enzyme inhibitors. If a patient has one or several kidney diseases, the doctor may prescribe several medications. Because hypertension can be both a cause and a symptom of a kidney disease, your doctor may prescribe a prescription to inhibit angiotensin-converting enzyme to slow down the rate of a kidney damage, or a diuretic to keep your blood pressure low. Kidney disease treatment. Sodium polystyrene sulfonate and calcium nitrate. To balance the chemical in the body that can suffer dangerous fluctuation when the kidneys are not working properly, the patient may receive medication such as sodium polystyrene sulfonate, which reduces potassium levels, and calcium nitrate to block phosphorus in the stomach. Kidney disease treatment. Iron supplements. If a blood test shows a low level of red blood cells, a doctor might prescribe iron supplements to replenish the body's reserves of erythropoietin, a natural substance with a role in blood biosynthesis. Kidney disease treatment. Calcium supplements. Your doctor might also recommend calcium supplements to help prevent bone thinning, an unfortunate side effect of chronic kidney disease. Kidney disease treatment. Limiting the use of paracetamol or ibuprofen. Due to the fact that many are excreted through the kidney, you will need to consult a doctor before taking any medication. Your doctor may not allow you to take drugs such as ibuprofen or paracetamol, which can harm your kidneys. Kidney disease treatment. Low protein diet. Although there are conflicting opinions, a growing number of physicians support dietary change to control chronic kidney disease. Some studies have shown that a rigid low protein diet can delay or even prevent future kidney damage. This is especially important for people with kidney problems due to diabetes. Studies have shown that diabetics following a diet that keeps glucose level within a raw limit slow down the progression of kidney failure. Kidney disease treatment. Dialysis. Treatment through dialysis, which uses artificial device to carry out kidney function, is necessary in case of advanced kidney disease. There are two types of dialysis more commonly used today: hemodialysis and peritoneal dialysis. What is hemodialysis? Hemodialysis uses a mechanical filter to purify the blood. The surgeon inserts a shunt, a small tube that connects an artery and vein, to the patient's arm or leg. several times a week for 3-4 hours at a time. Another tube is connected to the shunt and the patient's blood is pumped out of the body into hemodialyzer and then pumped back. What is peritoneal dialysis? Another method called peritoneal dialysis uses the peritoneal membrane, which has many of the characteristics of a peritoneum, to help cleanse the blood. A plastic tube is surgically implanted into the patient's abdomen. Thereafter, during each treatment session, a fluid called dialysate is infused through a tube into abdomen. The waste products transported by the blood, which circulates through the small vessel of the peritoneal membrane, are filtered into a dialysate, which is drained to the outside after a few hours. This process is repeated 3-5 times a day. While the fluid is in the abdomen, the patient can go about their daily activity. Possible risk and complication of dialysis. With both types of dialysis, there are potential complication risks, especially the risk of infection. Due to the fact that a patient needs to constantly do such procedures, he may be more likely to be stressed. For these reasons, patients with advanced kidney disease often opt for a kidney transplant. New drugs, often for anti-rejection and improved postoperative care, have greatly increased the success rates of such surgical intervention. What statistics are observed in the kidney transplantation? Today, the survival index by 3 years from a transplant from a relative is at a level of 75%. But if the transplant is from an unrelated donor, then the survival index is at a level of 60%. Not every patient with a kidney disorder can apply for a kidney transplant. The patient may have an underlying disease or other medical factor that does not allow such an operation. Phytotherapy for kidney disease. Specialists in traditional Chinese medicine use various plants to treat kidney disorders. Before using such products, it's recommended to consult a doctor about possible side effects. The fact is that many of these plants can harm the kidneys. Homeopathy in the treatment of kidney disease. According to some experts, homeopathic remedies are generally considered harmless in the treatment of chronic kidney disease. Still, they should be appointed by a specialist who knows not only alternative medicine but also has knowledge of classical medicine. It is important to know that homeopathy cannot replace classical medicine. What can happen if a kidney infection is not treated? Kidney infection required immediate treatment. If you do not get rid of an infection in time, then serious consequences can be observed. Any alternative method of treatment should be used only as an additional measure to the main course of a treatment and only after consulting a doctor. Treatment of kidney infection, antibiotics and bed rest. Antibiotics and bed rest can often be sufficient to control an acute kidney infection within 48 hours. The doctor will recommend that the patient drink large amount of water, at least 3 liters of water per day, in order to eliminate bacteria from the urinary tract through washing. What category of people can be hospitalized for kidney infection? In order to maintain the required amount of fluid and antibiotics administered, the following category of people may be hospitalized: young children, aged people, patients weakened by various diseases. Treatment of kidney infection, surgical intervention. Because chronic infection can sometimes occur due to return of urine from the bladder to the kidneys, surgery may be needed to correct this structural problem in the urinary system. Kidney infection recurs sometimes without obvious symptoms, so a doctor may order repeat blood tests and medical monitoring. Traditional medicine for kidney infection. Because kidney infections are so severe, most alternative medicine practitioners recommend conventional medicine to treat them. Homeopathy for kidney infection. Homeopaths use all now drainage therapy or various remedies to help the body rid itself of kidney infection. It is necessary to consult with a specialist in this field. A combination of terbinina, apis, and phosphorus may be used to treat a kidney infection. Nutrition for kidney disorders. Care recommendation. Proteins. No more than 1 gram of proteins per 1 kilogram of body per day. Potassium. No more than 2 grams per day. Phosphorus. No more than 1 gram per day. As a rule, it's also necessary to adhere to restriction in relation to protein. Sodium in case of advanced renal disorder, no more than 2 grams per day. Nutrition for kidney disorders. Calcium supplements. Calcium supplements 1.5 grams per day, often recommended to prevent bone thinning, but often accompany kidney problems. Nutrition for kidney disorders. What is recommended to exclude for healing? Sugar, artificial sweeteners, vinegar, spicy food, tomatoes, citruses, carbonated drink, chocolate, black tea, salt, coffee, alcohol, chemicals that are very harmful to the kidneys. Some of the chemicals we come into contact with every day can be very damaging to the kidneys. Even a connection has been established between acute kidney disorders and chronic ones with such toxins, chemicals. Carefully study the composition of various household products so that you know how to protect yourself while using them. The most dangerous chemicals toxins for the kidneys are cadmium, chloroform, carbon tetrachloride, ethylene glycol, oxalic acid, tetrachloroethylene. Cadmium. Where does cadmium come from in the environment? The content of this heavy metal in our usual habitat is mostly due to industrial pollution and poor environmental conditions. For example, getting battery containing cadmium into the soil water. Despite its particular toxicity, cadmium is still used in manufacture of various materials and means pesticides, rubber tires, plastic, paints. What recommendations should be followed in relation to cadmium? Limit your intake of foods high in cadmium. Such products are especially dangerous. Liver, kidneys, bream, mussels, oysters, vegetables that have been grown using sewage sludge. Check if any paint stain and ceramic varnish you use for art project or other work are cadmium free. Do not use kitchen crockery and old dinnerware. They may contain cadmium-based pigment. Avoid tobacco smoke. What is carbon tetrachloride? Carbon tetrachloride, a colorless, transparent liquid with an ethereal odor, is a solvent that was often used in the home until it was proven to be especially toxic. In order to avoid it, follow this recommendation. Throw out any old bottles or bottles containing various cleaning products from home. Use a carbon filter on your faucets to get rid of this chemical from your drinking water. What is chloroform? Chloroform is a chemical substance with a sweetish smell and taste that appears in drinking water as a product of chlorination and in the air as a result of industrial pollution and car traffic. Where is chloroform still used? Couch syrups, toothpastes, lipstick, pesticides, glue. To avoid chloroform, follow these guidelines. Keep your shower well ventilated. Chloroform volatilizes from hot chlorinated water and its level in the air can quickly rise in a closed shower stall. Read the ingredients of various products carefully and be very careful when using products containing chloroform. To minimize exposure to chloroform while showering, place an active carbon filter on the cold water pipe that is included in the hot water heating installation. What is ethylene glycol? Ethylene glycol is a clear liquid with a sweetish taste. This chemical is found primarily in antifreeze and brake fluid of cars, in cosmetics, especially in creams. In order to avoid exposure to ethylene glycol, follow this recommendation. Carefully read the composition of cosmetics. Avoid cosmetics containing ethylene glycol. Do not let children who are attracted to the sweet taste of ethylene glycol products play in garage or place where cars and their various accessories are stored. Oxalic acid. What is oxalic acid? Oxalic acid is used as a powder or liquid. This chemical is found in very effective cleaning products. Some skin whitening and freckly products contain this chemical. Oxalic acid is also found in leaves of some plants. In order to avoid its impact, follow this recommendation. Carefully read the composition of various cleaning products and varnishes. Avoid them if they contain oxalic acid. Do not use any litter bleach if it contains oxalic acid. Never eat rhubarb leaves because they are very high in oxalic acid. What is tetrachloroethylene? Tetrachloroethylene is a heavy colorless liquid and is one of the most used chemicals in cleaning products used in Western countries. Top recommendation for reducing exposure to tetrachloroethylene: keep windows open when transporting dry cleaned clothes, ventilate dry cleaned clothing outside or in well-ventilated area for at least 6 hours before bringing them inside, ventilate sleeping bags well after dry cleaning for several days before using them, avoid stain removers, carpet cleaners and paint removers that contain tetrachloroethylene. Prevention of kidney infection. Drink about 300 ml of cranberry juice every day. It is believed that cranberries have very good antibacterial properties, helping to get rid of infection of our urinary system. Drink more fluids, wear cotton underwear and not tight clothes that do not keep heat and moisture between the legs. They recommend to urinate as quickly as possible if necessary and empty the bladder completely. Disinfect your bathroom properly. Clean the toilet thoroughly after use. Women should wipe from front to back in order to avoid getting fecal bacteria into urethra. Prevention of a kidney infection for women. Avoid using scented soaps, bubble baths and vaginal deodorants because they all contain chemicals that can irritate the urinary tract, making it more vulnerable to infection. If using a diaphragm, make sure it's the right size and don't hold it for too long. Empty your bladder after every sexual intercourse to remove any bacteria that have entered your bladder. Thank you for your attention. This material was prepared on the basis of page all scientific attention before using various treatment and remedies. It is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.